Hello, everybody. Welcome to Monarch Family Chiropractic and our spinal workshop of the week here in October, covering the safety pin cycle. It's one of our favorites to do. It's how we're going to talk about why our body works, why that matters, and the connections between those gaps of how we perceive and what our body does in function. So we're going to dive right in and talk about how that connection happens. So when we talk about how our body works, and we use nerve charts and we use the pictures of the spine, and by the way, I'm Dr. Kristen for those who don't know me, if you're just tuning in and this is one of your first workshops, we're going to talk about how our brain and body connects. And it's through our nervous system, and it's through our spines, and it comes from our brain. And we really want to talk about the function of what we call our safety pin cycle. And so it is about the function of a safety pin when you think about how do they work? What is their function? And what happens if their function isn't clear? So we're going to look at a safety pin here and talk about, oops, let's see if it'll go this way. There we go. How and what works in our body's ability to use a tool, right? How a safety pin works when it's open versus how a safety pin works when it's closed, right? When it's open, I guess our question to you is, does it work? What does it serve its purpose in doing? And then we're going to connect what it is for the brain and body, right? So when it's open, it doesn't really do the job we want it to do, right? It doesn't hold something still, at least not very tightly if the safety pin is open. If it were built together, if you will, what would we see? Does it couple together? What do we use it for, right? We use it to close diapers. We use it to close or hold. I think of the multitude of pins I have at my house from putting bibs on, running an event and a race, right? It holds something together. It keeps information or something attached to where it's supposed to be attached to. So let's look at when it is connected. And this is what we want to think about by our brain and body connection, right? The head of our body sends information from the brain to the body. That's our efferent signal. And this body then has to send the signal back up to the brain. And that's the afferent signal, right? So when we think about there being stress upon a nerve system, stress in your spine, I want you to think about a safety pin that's open. So when we have our spine and we are looking so intently at our cervical spine, our neck, that connection, the top of the safety pin is the brain. And that signal that has to come down and leave the brain and then be called the spinal cord just the second it leaves this structure and goes right here into the neck, right? That signal from that spinal cord has to send its signal down and out every nerve on the right, every nerve on the left, and get it to where it needs to go to our body. Every cell, tissue, organ, muscle, everything is being controlled and sent a signal through that pathway. So when that safety pin is closed, it's working because it's connected to the top, the middle, and back up to the bottom, and then back up to the top. And so that signal comes down that cord through those nerves and out to the part of the body it needs its signal, right? Like digesting our breakfast from the morning or our lunch from the afternoon. We're not thinking about all those processes happening. They're just happening. And they're happening because that brain is sending that efferent signal through the spinal cord, down out those nerves, to the digestive tract, to all the components that have to break things down, put chemicals in certain areas, send them back to where they need to, and do what they need to, and then send that signal back up to the brain through that afferent signal that we just did what you asked us to do, brain. And it's given that full feedback loop to determine, okay, this is what it did. This is how hard it worked to do it. This is how long it took. And then here's what it is that I just did or what I accomplished, right? So the loop that occurs in the body continually, it's got to work in that positive direction and that connection, or it's going to work in a negative direction, if you will, or a disconnected way, like that open safety pin, right? So think about your open safety pin as your subluxation that is not allowing that signal to get from one end to the other, right? It is going back to this. And so when we're looking at the messages that continually are sent from the brain to the body through those efferent nerves, and then the body continually sends those messages via the afferent nerves back up to the brain, what is that doing for us and how well is it doing it, right? Hopefully really well. And when it does it poorly, then the body doesn't have as much ease, right? It's in dis-ease, dysfunction, and it causes things to work harder, causes the brain and the body to work harder. That signal is slower or disconnected from itself in those pathways in order to achieve the goal efficiently, right? So let's look at how that affects our health. To arrive at health, we need these components. We need to have the connection, right? It needs to have the communication path. So whether you're dealing with your own body, and is it better when the brain and the body listen and communicate together? Of course. So we think about things of how often do we reset or support that connection? And your adjustment is that connection between the two, because then we have a clearer path for communication, right? And what breaks up that communication or path is the subluxation, that inability for that signal to leave the spine, leave this house it protects it, and get out to its parts and piece if there is disruption or interference or lack of motion to that signal getting out, right? And so also think about coordination. It's got to coordinate a lot of things. And when it does so, the signal is easier. When it's not, the signal and communication path is harder or disconnected altogether and it doesn't get there. It all works better with more connection. So coordination really comes into play with how are all these systems in our body and in our structure and in our spine communicating and then coordinating that communication for an output, right? For an outcome. And so when we look at how we listen and how the body listens, we're looking at what does the body need in order to coordinate, right? So body, if it has that information break, then there is that disconnect, right? And our body can't work optimally. If that connection is there, it can coordinate all the signals it needs to get, again, digestive tract doing what it needs to, it recognizing what's coming in, what do I have to do to break it down, and what do I have to do to make it break down, absorb, and then exit what I don't need, right? I think that's a simple thing to look at in kind of the thought of everybody, and I think for the most part understands digestion. But again, that connection gives the body the opportunity to work. The communication allows it to be more efficient. And the coordination is that it just does it well, right? It coordinates with all the other systems. There is so much chemistry in our body going on that we don't even have to think about, that is coordinating how our day goes and what our muscles get and what our lungs get and what our brain gets and the oxygen going to everything. And the secretions of everything else going where they need to go. And I just think about the level of coordination like a symphony that has to happen. Everybody has to do their part for it to work. And that ultimate goal or that ultimate outcome is our health. It's how well we function. It's how well the outcome of what it is we get to do day to day is. And so as we path through connecting that, whoa, let's back up a slide. There we go. So in all the coordination we're doing and adjustments, it is freeing that flow and opening up that signal from the brain to the body based on the connections made through the spine and the nervous system to really give that closed safety pin and cycle what it needs, right? And so that all those matters of life depend upon that, right? If there's any trauma to a system, and the body's been compromised? Are we worried about somebody eating? Are we worried about reconnecting that? I always think about the example of when, say we come across somebody that is unconscious, right? And, or has an injury to them, a trauma. And it could be getting knocked out in a sports event. It could be having been in a car accident. It could be falling off a swing set. It could be landing wrong in an activity or an event that you're doing, like skiing or playing any kind of sport, weekend warrior things or otherwise. What's happening when we come upon that person? What we want to make sure is, what do we first check, right? Are they injured? Are they breathing? Are they choking? Like, do they have air coming in? Do they have a pulse, and are they breathing, right? And if that connection is happening, then what next, right? We need to support how the body and the brain are getting its communication and wake it back up, if you will. We don't go, oh, let's just see if they need a sip of water, or let's shove a power bar down their throat, right? That's not the first things of importance. It's important that that brain and that signal getting to your body is functioning and is there and is getting through, and then figure out the components from there, right? So it's really about if the spinal cord this isn't stable, that's what needs to be stable. That's the most primary thing that matters. That is the most vital component in our bodies. All the other pieces and components, we can live periods of time without. That is not what runs us and connects us. Long term it is, but not in the moment to moment, second to second, minute to minute. So what happens when those things aren't connected, right? Health is an expression of life. So if we are not expressing life, it is many times because somewhere along the path, it has been disconnected from us, right? We don't have that ability to coordinate. We are not communicating well within our body and our brains the way it's designed to do. And therefore, it's not connected to what it needs to do in its day-to-day function. It is in survival mode many times when we lose these components, right? When it interferes with health long enough, then we're looking at chronic illness and injury and things that have been there for years or decades, because it's the suppression of the body's ability to express health, and it leads to a very deficient system and a very deficient immune system and function, right? The body cannot do what it needs to do. The brain cannot do what it needs to do if that communication path and coordination is disrupted and disconnected. I guess this is a great time to bring in kids into this component, because I think about traumas that kids have and how that health gets disconnected early on, and we don't know it or realize it or see it or relate it to this because of how we're poorly educated. And so if a kid has a falls off the bed, falls off the changing table, falls in a sport, gets hit in the head, lands off of a swing set, gets knocked out in a sporting event, or falls in some, activity off their bike, or in doing any such thing, it has got to be a priority that we check them, that we connect to see if the connection and coordination is happening between their brain and their body. They are so in such a growth phase. And it can be deceiving that there's nothing wrong when they can get up and shake most things off, or the discomfort from them is maybe minor or short lasting. That is not a correlation to the significance that it has in their system and in their brain and body communication path. And those, what may seem small disconnects or injuries into the communication path, or opening of those that safety pin loop, in long term creates major masses of poor coordination and inability for them to thrive and heal and just become the amazing young adults and adults that they can be. So it is really our goal that we start them off on the right path, and we're checking them between all those types of phases and milestones in life, because it will matter for them as an adult. And the best thing you can do is get your kids checked. So hopefully that's a piece that came out of this. Is not an adult problem. This is a human problem. This is a human concern. This is something that happens to all of us, is subluxation. So in connecting, again, the two, that's what chiropractic adjustments do. We are supporting and being the connectors of the brain and the body. We do not fix this. The body fixes this connection. We are just removing the interference that the disconnect is being caused from many times. And in removing that disconnect, the body, the brain can reestablish those connections and close that loop of information from the efferent and afferent loop of the safety pin and bring us back to a state of ease and a state of health. So we're looking at a problem on the left with subluxations and a solution on the right? So it is one thing to say, you know, the safety pin being open is a subluxation. And when I learned what that word first meant in school, actually wasn't so much in school as it was by a dear mentor of mine, is that sub is less than, lux, light. And it's less than the light we're supposed to shine. And the disconnect or the communication that's lost there in a subluxation is very deep into a lot of different levels. I'm trying to find the right words to express that, I guess. And so it can come in all shapes and forms. We can see it as pain. We can see it as inflammation. We can see it as muscle spasms and ache and trigger points and discomfort that way. We can see it as the severity of numbness and tingling, which is worse than pain. That is more pressure on it than when the pressure of the signal when there's pain. So even though it feels less uncomfortable, it is more serious. The problem is bigger, and that safety pin is further open, if you want to correlate it that way. So I hope that we are not connecting that there has to be pain, but you don't feel subluxations, as many of you have been talking about and learning with us in the office this past week through your progress evaluations. It's that we feel the effects of subluxation, right? And so I want to share a sheet with you before we close. Hopefully you will be able to see this if I put it up. Yeah. This is, again, the effects of subluxations, effects of that safety pin being open. And so when we find areas of subluxation or disconnect in that red or purple area here in the neck, the C1 through 7s, right? And that area in the skull, the occiput. That's the types of things that control that top third of the chart there on the left, right? The cause area, eyes, ears, nose, throat, all of the brain, parts of your immune system and digestive tract, that vagus nerve, that calming part of our nervous system, right? And what you see to the right of that is the effect, what you might feel, what you might experience if there's a subluxation. And that is the slew of things that can go from migraines and headaches to things like inflammation of congestion and allergies and asthma, to things like jaw pain and neck pain, but it can really mess with our chemistry system. And so it may be a difficulty in sleeping, a difficulty in concentration, brain fog, anxiety, depression, a slew of things. So the most important area that we're checking first and foremost, no matter what you come in experiencing, is up here. Then as we get into the thoracics, those are the T's, 1 through 12. That is the green, the yellow, and the kind of orange color there. That is all the area running our organ systems and that functioning of our systems, right? So also the area that goes down into the shoulders, arms, and hands. It affects and has a lot of crossover, but as you see, it is components of, you know, our upper circulation, our lungs, our heart, our cardiac system, and then all the things into that digestive, getting into processing, pancreas, liver, kidneys, gallbladder, the components of spleen, all of those things, our adrenals, all those things that help run us and process the things we put in. And then as we get into the low back and lumbar area, that is the area into the blue, and that is the L1 through 5, and then our sacrum and ilium, which is our tailbone and our hips, right? All through here. that area is doing the rest of our digestion and our exiting, our bowel and bladder. It is running all of our major hormone control. So our ovaries, our uterus, our prostate gland, all those areas must be receiving clear information from the top down for that signal to be clear, right? So if I have a disruption up here and I have low back pain or problems with getting pregnant or IBS or constipation or leg pain shooting down to my toe, all of that is coming and affected by this area here. And the signal has to be clear all the way up here for that signal to matter and get to down here. So for us to just treat your low back for those problems, because that's where that signal goes to, would be a disservice, right? Because that signal has to leave that brain and get through the other 2/3 of you to even get to that area of the low back and what runs that area down to your feet and everything in between. So I slowed down with that because hopefully you see how connected we are and look at this more like a safety pin or a loop, right? That we're not just parts and pieces. We are a whole unit, and we need a whole unit to be healthy and a whole unit to function for that health. So I close in saying, our ask of you is if you know someone in your circle, in your family, in your tribe, you alone too, if are not getting checked or adjusted, and to find out if those subluxations are present, please call us, please check in. And if you're viewing this because someone sent it to you and you're not in our neck of the woods of Denver, Colorado, then reach out, give us your zip code. We will find a chiropractor that you can go see that we would recommend or that we can find that's as close to you as possible. Our community is wide, our community is large, and our community is there to support. So I want you to take this and find a person in your circle that you can share this with. Dr. Mayakin and I and the team are opening up the office to actually more new patients than ever this next 5-6 weeks. And as we get into that first week of November, we will be having our Patient Appreciation Week. And that is where patients are examined, scanned, evaluated, and treated at our expense until those appointment time slots are gone. So for anybody in your community. So reach out to Jesse and the gals at the front desk, and they will be happy to set you up with the time and availability to have your loved ones and family, friends, coworkers, neighbors, people in your community checked. I am excited to see you in the office and hear your takeaway from this workshop and tell me something you didn't know that you just learned. Maybe it's an area of where your subluxation feels like it is. I would like you to know your subluxation area and the areas that controls and goes to. So my challenge to you is come in knowing that, or come in to find that out if you don't know. And I look forward to seeing you in next week's workshop. Thank you for joining us with Monarch Family Chiropractic, and we look forward to seeing you soon.